어제 뉴욕타임즈 기사인데 그중에서 관심 있는 몇 개를 좀 쭉 한번 읽어보겠습니다. A new way of caring for older Britons. England. Pharmacists, therapists, doctors, and others are gathered under one roof. A new way of caring for older Britons. Older people were sort of lodged in the wrong places in the health and care system. For 12 years after her husband died, Norma Fitzgerald tried to maintain her independence, living alone in an apartment on the outskirts of Hull in northern England, despite her worsening mobility as she reached her mid-80s. Then one day in the spring of 2022, she suddenly grew dizzy. Her legs gave out, and she collapsed on her apartment floor, unable to find the strength to get up. She lay there for 2 days. Eventually, a neighbor realized she hadn't seen her for some time and called an ambulance. They had to force the door open. Miss Fitzgerald, who is now 87, recalled she was severely dehydrated and spent the next 5 days in a hospital. As Britain's population ages, with almost 19% of the population over 65, according to the 2021 census, up from 16% a decade before. The need of an increasingly frail older population are weighing on the country's health and care system. Along with the National Health Service, or NHS, many older people also rely on what is known as social care, a mosaic of private and public support that is plagued by chronic staffing shortages, a lack of nursing home beds, and slashed local budget. The lack of easily accessible social care, which encompasses everything from home health aide who help with washing and dressing to full-time residential care, means that falls or treatable health condition can lead to extended hospital stay. That is piling pressure on the NHS when earlier intervention or home support would have been more appropriate. But what happened to Miss Fitzgerald after she was discharged from the hospital is an example of an approach that could transform the way that older adults living with a complex health condition are cared for, experts say. In the past, she would likely have been sent to the home with little continuing care aside from her family doctor, or she might have had to move into full-time residential care, losing her independence. Instead, she was referred to the Jean Bishop Integrated Care Center in Hull, a facility that opened 5 years ago as a one-stop shop for frail older people. The first of its kind in Britain, it brings together doctors, physical therapists, social workers, and other professionals under one roof. In the course of a few hours, a patient can see a number of clinicians and have a diagnostic test if needed, including x-rays and blood tests, and receive a personalized care plan, all free of charge. On a sunny morning in June, Miss Fitzgerald sat knitting a red and gray blanket in the center's bright and cheerful waiting room. She had been brought by ambulance. All patients are offered transportation if needed. From her assisted living apartment to see a doctor specializing in geriatric care, a pharmacist, an occupational therapist, and a social worker. Many geriatric health experts believe this kind of integrated care with a multidisciplinary team addressing all the issues that can affect well-being, from loneliness to immobility, is the future for older people with complex health needs in Britain. Dr. Dan, a geriatrician and one of the center's clinical lead, see his job at trying to prevent crisis rather than simply reacting to it. As in Ms. Fitzgerald's case, the center contributed to a 13.6% reduction in emergency room visits and hospital admissions among people over 80 and 17.6% drop in ER visits by patients in care home in the areas between 2019 and 2022, according to NHS data. The future of health care is as much about what happens out of the hospital as what happens in it, Ms. W. said.